Now, Gauteng remains hard hit by the coronavirus, and the health department is doing all it can to save lives and curb its further spread. ETV reporter Pule Letshwiti brings us an exclusive from a COVID-19 ward at the Tshwane District Hospital in Pretoria. He's there speaking to doctors at the frontline and patients about their experiences.
So we're currently in a COVID ward where patients who've tested positive are being treated. Now, this has never happened before, where for the very first time we've been granted access to get into these wards and see how patients are being treated. We're told that the beds have also reached their capacity, but the health workers here say they're doing all they can to actually save lives. Currently now we're going to be speaking to Mr. Frank Bootswa, who's a nursing manager here. So thank you very much for joining us.
Okay, thank you.
It's resilience and hard work. We see that there's quite a lot going on here. How's the morale of the staff during this tough killer pandemic?
It's very difficult to keep the staff morale up, but I'm happy because we've got a very wonderful team at Steve Biko and Tshwane District Hospital, which is looking at lifting the morale of our staff up. We've got a very huge team made out of psychologists, social workers, the hospital staff. We've got other team members who come together with the family medicine from the University of Pretoria, who are really helping in terms of counseling staff members. What we are doing is every day between the hour of 10 and 1 o'clock, all our staff members are coming outside where the psychologists and the social workers are waiting, and then they are allowed to ventilate all the challenges they're having, all the difficulties. What you also need to understand is we are also losing some of the patients, which we don't want to. Really, this is not our aim. Our aim is to save life. But sometimes things like this happen, so our staff become very sad because of that. So we've put measures in place to support them in terms of the loss, in terms of the workload they're facing, in terms of the challenges, in terms of the fears. So we are almost every day giving this counseling service to them.